Yeah, I'm just gonna go over. I'm gonna start with a recap actually, because it's got quite complicated with different proposals that were brought in by the previous government and which ones are still there and which ones they scrapped, and then get to the green paper. So to recap, going back to March 2023, I remember we actually had a DPAC meeting, an emergency DPAC meeting in March 2023, 2 years ago, about this white paper, and we were actually less scared, I think, then than we are now. That was Transforming Support, the Health and Disability White Paper, and that made it quite clear that the then Tory government was worried about what they call the affordability of the system. In other words, obviously, the budget matters more than the lives of disabled people who are sustained through through social security payments. Um, the proposal was to abolish the work capability assessment and to replace employment and support allowance and universal credit instead with what they were going to call a universal credit health component. And to access that health component, people would need to have been found eligible for personal independence payment. And of course, not everyone who is on out of work disability benefits qualifies for personal independence payment, PIP. It's a completely different kind of benefit with its own very arduous and difficult assessment process. So we were very worried about that. For all that we campaigned against the WCA for years, this seemed like a worse option, actually. But Labour, the incoming Labour government, were clear that they would scrap that. And instead, they said that they would co-produce an alternative with deaf and disabled people and our organisations. 6 months after the white paper came out saying the government would abolish the work capability assessment, um, the government then surprised us, because we'd had no warning of this, with a consultation on how to bring in interim changes to the work capability assessment. And this was quite clearly about achieving savings in the autumn budget, hence making changes to something that they were intending to scrap. The way that the consultation was framed, it was all about wanting to help and support disabled people to help us escape the trap of poverty by supporting us into work. What the consultation never mentioned is that the proposals would mean essentially cutting the amount of benefits that people could qualify for. It didn't mention anything about the savings that would be achieved by these changes, and it didn't mention anything about the fact that more disabled claimants would be brought into the conditionality regime, where people are forced to look for work, and if they are not seen to be complying with the work requirements placed on them by their work coaches, then the benefits can be stopped through sanctions. There were two main groups who were targeted by these changes. It was going to be made more difficult to be found unfit for work, or in the DWP jargon, to be found to have limited capability for work-related activity, LCWRA. And those two groups were people with mobility impairments and people in the substantial risk group. And people in the substantial risk group are people who are judged by medical professionals and others in our lives to be at serious risk of harm to ourselves if we were forced to do the kind of engagement with the DWP and to be put into having mandatory activity. The total number of disabled people who would be affected by this was calculated as about 453,000 to be affected by 2028 to 9. And this was only going to apply to new claimants. But for example, if an existing claimant came off their benefits for any reason and then had to go back on again, they would be going back on as a new claimant. 424,000 of those would have received a reduced benefit from what people in that group would get now. And they would be subject to conditionality and sanctions. Now, it was never quite clear in the consultation or ever what they meant for people in the substantial risk group. They didn't ever produce anything that was clear on what kind of activity people would be expected to do, but there was definitely some mandatory activity intended there. So out of all of this harm that would have been caused, only 3% would be able to find employment. That's 15,000. Because the point is that people in the LCWRA, or what the ESA support group, are people who have been found unfit for work for a reason and through a very difficult assessment process that actually a lot of people who should get through don't. So the government was preparing to lay the regulations in Parliament for this because the way it would have been done through the parliamentary process meant that it didn't actually need a vote on it. Labour was actually, it hadn't ruled out, and we were having conversations with them about tabling what they call a prayer motion, which is one of those archaic parliamentary things that would have been an attempt to try and get in the way of the laying the regulations. Now, a prayer motion has never worked since 1979, so it probably wouldn't have worked, but it was a way of trying to raise awareness and get more of the public to understand the harm that these measures would actually cause. So although Labour didn't come out against these proposals as such, there were discussions about whether they would try and help us against them. But then they came into government and they wanted to go ahead with those, and they wanted to achieve the same savings to the budget as they would have done. But sticking with the recap and the Tories, so we had that surprise consultation. We were all very frightened by those proposals. And then in April 2024, Rishi Sunak, who was panicking about his job and how unpopular he was, made an announcement in April, which was clearly about him trying to appeal to what he thought would placate voters and backbenchers, because he decided that attacking disabled people was how he was going to cling on to his job. And he announced a package of sweeping reforms, which included the work capability changes that the government had already said they were going to do. And so just so that we know what Labour kept and what they didn't. So when Labour came into government, they defended those proposals. They defended them fiercely in court. He also announced a consultation on reform of personal independence payment. And some of the things in that consultation were frightening to people, such as replacing the cash payments with vouchers and so on. There was a huge response to that consultation. I think it was around 6,000 responses that were received. The consultation carried on because it covered the period of the general election. The consultation carried on, it ended, but then we heard from Labour that actually they weren't going to go ahead with the proposals in that consultation, but that we would be hearing about something that they were going to do. And there was always the promise of disabled people being able to be involved in shaping whatever those alternative proposals were. Another change was to increase what they call the administrative earnings threshold and to bring more people into in-work conditionality. So what that is it's a level, and if you earn below that amount, then you have to engage in intensive work search in order to find either more hours of work or higher paying work so that you're less dependent on top ups from the government through your universal credit. So they brought more people into in work conditionality. Now, this was already something that was being rolled out um, by the government, and it's something that has uh, that Labour have not reversed. So what the announcement was saying was that they were going to rush ahead and they were going to bring in the changes that they had planned to do, but quicker. And that hasn't been reversed by Labour. And we know 27% of people who are impacted by in work conditionality are disabled people. And often these are people who can't go and find other work. They don't have time to, don't have the capacity, may not have the energy to, or not be well enough to. And they face the same barriers to looking for work, such as digital exclusion and work coaches not understanding their access needs. So this is a continuing problem. They also announced they're bringing a fraud bill, and that was going to give DWP police powers to be able to seize assets from people they decided were guilty of fraud. And Labour said they would scrap that and not go ahead with that. But they've now got their own new bill, which is very similar and contains a lot of new surveillance powers for DWP, which organisations like Big Brother Watch have said it violates civil liberties. They also said, brought in a measure that would remove benefits entirely from the long-term unemployed who don't accept a job within a certain amount of time. So that's saying that you only have so long to be able to look for a job in your chosen field, and then after that you have to take any job that you can get, and that is still in place. Labour came in, they defended the changes to the work capability assessment. And what we found out through the court case was that there had been no assessment of employment outcomes or equalities impacts before they published the consultation proposals. The only thing they cared about was the potential savings. They'd scored which changes to the work capability assessment would save what amount of money. It was only after the consultation was published that they realised that actually only 3% of those people would be able to work, and that would mean pushing a lot of extra disabled people into poverty. An extra 100,000 would have been pushed into absolute poverty. They found that out, but of course they didn't care. The consultation was done in was bad faith. I mean, as I said, it was framed entirely around this idea of supporting disabled people into employment when no one would be able to get in. But they wanted to make it look like a proper consultation where they were actually interested in hearing our views and properly considering the issues. We saw through the court case internal communications whereby ministers and civil servants discussed the fact that they should include in the consultation measures that they had no intention of trying to bring in, changes that I think would have impacted on people with social anxiety, for example, losing money because the idea that everyone can work from home now. These changes would only have produced negligible cost savings, but they decided to keep them in order to make it look like a proper consultation. Ministers also knew that these changes would cause mental distress, but again, they didn't care. They knew who the people are who are in the substantial risk group and the kind of impacts that this would have on people who self-harm and live with suicidal ideation. But instead of caring about that, there were discussions about how to create positive mood music around the consultation. And this included getting Fraser Nelson to do a documentary to communicate to the public what need there was to get people with mental health conditions into work. Now, these suggestions were actually dropped because it would have been unlawful to do this kind of thing at the time of a consultation. However, what we saw a few months ago was a documentary with Fraser Nelson talking about getting people with mental health conditions into work. It presented people in a very narrow way Of course, people do want to work because there's so much stigma about being out of work now, but it never looked with people at the true level of barriers that they face. For example, there was a woman who'd left home at 13. There were obviously reasons why she'd left home at 13. She would be carrying a lot of trauma, but all of those deeper issues were completely overlooked. It was all about presenting an image to the public of large numbers of people who just have a bit of anxiety and depression, who really we should be making work rather than living on the dole. Labour's response to the legal challenge, so they defended it so fiercely we had to go to an interim hearing where they argued about the documents that they were meant to disclose to us. They lost that. There were very damning comments from the judge, but this was very unusual and it was very disappointing and upsetting that a Labour government would try and defend proposals that would have caused so much harm. But they did it fiercely, and then they had a plan already orchestrated for when the judgment came down in our favour. The very next day in the Sun, there was Keir Starmer boasting that he has the balls to be ruthless about cutting disability benefits. Now, I don't think there is anything to boast about pushing people into poverty and despair, but he thinks that's a cool thing to do. There was also uh, inquiry that the Lords Economic Affairs Select Committee had apparently been having all this time. And the week after the judgment came down, they sent a letter to the Secretary of State for Work and Pensions, which was widely publicised, urging reform of the welfare system from the findings of this so-called inquiry. That inquiry never had a call for evidence. The list of witnesses was very restricted. The only reason why a witness with any knowledge of disability attended, Ben Geiger, who many of you know, who does brilliant work, was because another witness, Jonathan Portes, knew he knew nothing about disability, so brought Ben along with him. The only people who were asked to give evidence were people from economics institutions who were looking at figures and the idea of needing to make savings. But of course, that got a lot of publicity with the idea that the system's broken. There are loads of people sitting on unfit for work benefits who shouldn't be. A couple of weeks ago, we then had a media story about 200,000 people who have been found unfit for work, who are ready and willing to work now. And alongside that, Liz Kendall made comments about how there are people who are on out of work disability benefits who are taking the mickey. Of course, we all know that that is not the situation for people in this group. We do not choose to be in it. We need to be in it. The survey is very interesting. If you actually go and look at the survey data and pick behind it, it turns out that these 2/3 of the 200,000 who are ready and willing to work are people who are autistic and people with learning difficulties. Many people who are autistic and have learning difficulties would really like to work, but the workplace is notoriously discriminatory against this group of people. We've had many times in the past where employers have lobbied to be able to pay people with learning difficulties less than the minimum wage. The survey question was also whether you could work now with the right job and if the right support was available. Now, many of us could say, yes, that could be true for us. But the reality of there being the right support and the right job available are zero. So it really, the way that this was presented in the media was really disingenuous, but it was all about laying the groundwork for what they were planning with the green paper and the financial statement. For some reason, hold on. There we are. Um, so there's been a narrative behind all of this, which they've been spinning, which is that welfare spending is out of control. John Pring from Disability News Service got some data, that should be data, not date, from the Office for Budget Responsibility. And that clearly shows that welfare spending is lower now than a decade ago and is not set to rise over the next 5 years. Ben Geiger has also done work on this. If anyone has seen his blogs, he's been writing quite a lot about this, and it's really useful. And what he said is that welfare spending hasn't gone up as a share of GDP, but what is true is that disability benefit expenditure as a proportion of welfare spending that has gone up. And one explanation for this is that the state pension age has increased. So, of course, people who would have been the money going on their social security would previously have been under the state pension budget area. It's now coming out of the out of work disability benefits budget. Um, but it is also true that alongside that, disability prevalence is rising, but there are many reasons for this. For example, austerity and welfare reform and the financial insecurity that has created. For example, COVID and the impacts on people from the death, the trauma, lockdown, etc., and the government's failure to handle it properly, the cost of living crisis. And then we've also got factors like the impact of social media on our young people. These are things that the government should be looking at and looking at how to address and put in place proposals to address in a compassionate way that seeks to support the population instead of punishing us. So what we know now, thanks to ITV, we have a clearer idea since Friday on what is coming in the Green Paper. They've said that they'd heard that the Green Paper is going to be out between the 17th and the 25th, but these things can always change. And then we've got the financial statement on the 26th of March, which will contain the information about the savings the government intends to achieve from these changes. It seems that they're looking to save about 6 billion a year, 5 billion, a whopping 5 billion of that by making it harder to get personal independence payments, PIP. And we know it's already too hard for people now. They want to achieve further savings by freezing PIP payments next year, so they won't go up in line with inflation. They want to raise the basic rate for universal credit. Which is welcome because it is inadequate. That is welcome, but while cutting the rate for those who were judged as unfit for work. They are going to invest 1 billion spent on employment support with 1,000 existing work coaches deployed to deliver intensive voluntary support to around 65,000 disabled people. Again, it is welcome to do better on employment support for disabled people, but if it's going to be the same old kind of support, which is CV writing and expectations on people that are never going to help people be able to find jobs because those jobs just aren't out there, then that's really not going to achieve anything. Disabled people are already among the poorest in the country. Because of time, I'm not going to go through this now, but this will be on the website with different statistics that show how many of us are living in absolute poverty and how poverty has dramatically risen over the past few years. It dramatically rose even before the cost of living crisis. 54% of all poverty in the country is now disability related. We know that personal independence payment that is an extra costs benefit, and we need it to contribute towards the unavoidable additional costs of disability that we face. So Scope estimates that households with at least one disabled adult face additional unavoidable expenditure of £1,067 per month. And that's a lot, and PIP doesn't cover all of that by any means. PIP applications have been rising, but that's no wonder through a cost of living crisis. John Pring did a Freedom of Information request and was able to get made public some research that was carried out under Therese Coffey's period as being Secretary of State, but was sat on, probably because it was inconvenient. And what that showed is that people are applying to PIP, new applicants are applying because they need the money, the extra money to pay for daily living expenses. Now, it's meant to be spent on disability related costs, but people have to fund daily living expenses first. It doesn't mean we don't still need money for AIDS adaptations and therapy costs. People do use their PIP for that where they can. And 42% of PIP claimants are in the poorest, 20% of the population. Some PIP claimants are in work because PIP's not means tested. And many of those who are in employment say they won't be able to carry on working without PIP. So the impacts of these proposals will be a significant increase in disability-related poverty, and there will be a knock-on to child poverty rates because of the figures that showed a dramatic increase in poverty among disabled people. The highest increase was for families with one disabled adult and one disabled child. There will undoubtedly be increased mental distress, self-harm, benefit deaths, and suicides. There will be increased pressures on the NHS, mental health services, social care services, and an increase in survival crime. This will put immense pressures on public services that are already struggling now. And we know that poverty costs money. In 2016, the Joseph Rowntree Foundation estimated that poverty costs the economy 78 billion a year, and that £1 in every five is spent on public services goes towards mitigating the harms caused by poverty. So that was a figure from 2016. It's going to be a lot higher now. So the idea that this is going to be beneficial for the economy is just preposterous. So, this is a frightening time. I know people are frightened. I'm frightened. But I think we should focus and remember what we can achieve when we come together. We chased Atos out of the contract for the work capability assessment. We forced George Osborne to do a U-turn when he came for PIP in 2016. We have the links, we have a memory of what worked through the last decade and a half. So in some ways, we are in a better position now to resist than we were then. I know that we're burned out, we're fighting on multiple fronts, but we do have brilliant younger activists coming in. I think we need to look at this as a time when we can show exactly what we can do as a movement. I think we can force this government to rethink. It isn't a popular government. It's not a government that's good at being a government. And people do care about disabled people. The majority of people want a welfare system that support a social security system, actually, I should call it, that supports those who need it. The majority of people want that. It's just a case of being able to get to people to expose what is happening. I think we can do this, and more than that, I believe we can do it in such a way that teaches future governments not to come for us again. Thank you.